selecting the topic, and we took some tips and probably discussed some examples as well. So this is an extension of yesterday's session where we go on further refining our topic of interest and we use some frameworks. So let's go. So when we think of refining the topic, we come to the concept of study objectives. And the study objectives, we are going to talk about that in more detail today. And the study objectives usually contains two important concepts for any research. One is the concept of study variables, and the other one is the concept of study population. So we'll start with having some understanding as to what are the study objectives. So there are two terms which are very commonly used in any research. One of them is the word aim, the other one is the word objectives. How aims and objectives are different. You would have heard the words aims and objectives very commonly. So for example, for PG thesis also, these words are used very commonly. So aim is usually, study aim is usually one, and it's something which is little more broad or umbrella term, whereas study objectives would be more specific. So you could, let's say, have one aim and two or three study objectives as well. So aim would be broad and objectives would be specific, and objectives can be more than one. So let us understand this taking few of the examples. So the example one is such where, let's say, the aim is, and we have taken these examples from the list of topics that we have shared on Google Classroom, the list of 50 topics. And try and understand. So through the course, we'll be once again going back to some of the few selected topics from that list to understand how the different parts of the proposal writing we'll use those examples to understand the different parts of the proposal writing. So we are utilizing them to understand how aims would differ from objectives and how do we frame our objectives for our STS proposal. So let's say, for example, one, the aim is to study capacity of adult villagers on managing snake bite, and the objectives could be to describe the proportion of villagers who can correctly identify a poisonous snake, or who could correctly differentiate between a poisonous versus non-poisonous snake, and to describe the proportion of villagers who have knowledge of correct first aid practices, right? So when we read this, we understand that it's very simple and pretty straightforward, right? So that's what STS is usually expecting. That the objectives are very simple, clear, and focused. Right? Let us take another example. So here the aim is to study delay in management of myocardial infarction. Myocardial infarction is what we commonly refer to in layman's term as heart attack. So to study delay in management of myocardial infarction among patients presenting to emergency room of XYZ hospital. Right? So this delay in management, they are measuring with the time duration, right? So there are two objectives. The first objective is to estimate the median time taken from symptom onset at patient's house probably to arrival at the emergency. So that's time taken from symptom onset to visiting the arrival at the hospital. Second objective is to estimate the median time taken from arrival to hospital to treatment initiation. So probably a part of the information would come from, let's say, patient's clinical records, what's there in the history, and probably also talking to patients and taking history afresh, right? And so that's the source of information. Let's take third example. This example is to study how thyroid function affects pregnancy outcome. And so that's being a broad objective, broad aim. The objectives being to estimate the proportion of pregnant women with thyroid disorders who are coming to a probably obstetrics OPD in a XYZ hospital. Second objective being to determine the association of thyroid disorders with pregnancy complications. So say, for example, to find out if the woman is hypothyroid, is she more likely to have complicated pregnancy, or if the woman is hyperthyroid, if she is likely to have more chances of complication at pregnancy and delivery, right? So one of aim and two objectives. This last example, where the aim is to study health-seeking behavior of transgender persons. We took this example in the last session yesterday, and the objectives being, so instead of two here, we have three objectives. So first objective being to identify the common health problems faced by transgender persons in last 1 year. Second is to describe the treatment sector preferred by them for their health-related problems. So do they prefer to go to government clinics or do they prefer to go to private clinics for this? The third objective being to describe the reasons for their preference of treatment sector. So they might have their own reasons as to they may feel that the government sector is providing more authentic treatment or the private sector it's more, let's say the waiting time might be less at private sector, the comfort and level of let's say sanitation, they might be better at private health sector facilities and so on. So these are only reasons that we can assume, but when we talk to them, probably we'll find out the reasons as perceived by them, which is important to study and document. So one aim around health seeking behavior and three important objectives, right? So when we read those objectives, we understand that they are simple and very clear, right? So that's what the STS is expecting. So having gone through a few of the examples of the study objectives, we understand that this is what STS might be expecting. Right, let's look at revisit this particular part. Yesterday we looked at DHR portal and saw that there's a one-pager guidance document on writing the STS proposal. And that proposal had the objectives also an important element. So they have given word counts as well. We visited this yesterday and we understand that you can have maximum 100 words for objectives, right? It's not necessary that you use all 100 words, right? But your objectives has to be simple and reasonably clear. So whatever words that it takes, but objective is an important element of our protocol writing. So from today onwards, in fact, we have started thinking about what would go into our actual Word document of our study protocol, right? So we have started talking about the study objectives. Now we understand what are the different elements of study objectives. So there are two primary elements. One is study variable and study population. Now, when you will be looking at the various literature available on internet or various resources, various videos, various online courses available on internet, you will find a lot of terminology, a lot of jargon, a lot of more detailed information as to how study objectives can be described or how, let's say, people would probably compare that with research question and identify different elements and different frameworks in describing the research question. But for the purpose of this course, since it's at the undergraduate level, we have preferred to simplify the concept and saying that it would be okay to identify the study variables and study populations clearly and study objectives. That's probably good enough for an ICMR STS study. So we'll go through both of those concepts in more detail, also taking some of the examples. So what is a study variable, right? So in community medicine and biostatistics class, you might have, for second year students, if you have started studying biostatistics, you might have come across this terminology of what is data and what is variables. So variables, study variable or variable per se is anything whose value varies and that you are interested in studying, right? So say, for example, blood sugar values would vary from person to person and from within an individual person, it can vary from time to time, right? There was another study yesterday, probably we talked about, which was about serum lactate levels. There is a study we just now talked about saying what's the proportion of villagers who can identify poisonous snake. So that information can vary. If you give a health education session, probably that proportion would increase who can correctly identify a venomous snake. What's the score on quality of life questionnaire out? Let's say if the questionnaire is of 20 marks, how many marks does a particular person score at particular point in time? What's time taken from symptom onset to arrival at an emergency room? So this would be different for different people. Some person might make a lot of delay and let's say reach the emergency room after 3 hours after symptom onset. Someone else might be little quick and let's say reach the emergency room within 30 minutes. So the time varies from person to person. Hence, we are trying to find out what's the average time taken by patients. What's the hearing score through Hear WHO mobile application? So if someone is interested in doing some study about the hearing capacity of individuals. We yesterday talked about out-of-pocket expenditure for medicines. So for example, during pregnancy. So we measure that in rupees. How much amount did the family of the pregnant lady who's delivering at her hospital had to take out of their own pockets for the purchase of medicines. Proportion of houses who are correctly segregating plastic waste. And we saw that in the dengue affected area, less proportion was correctly segregating. In highly dengue affected, not affected area, more proportion was segregating. Number of iron tablets a pregnant woman took during a month. So all of these are study variables, right? So having understood this, probably it is time for us. I would request on the next slide, we'll have some of the studies. And I'll request all the students to tell us either on the chat, or you can unmute and tell us as to what is the exact study variable in the description of the study objective. So we'll have few of descriptions of the study objectives appearing on the slide. And if you can interact and respond, probably we will have better understanding as to whether you are able to follow the concepts or not. So let us go to the next slide. So the task here is identify the study variable in this description of the study objective. So this is the first study objective. You can read it and either unmute and respond, or respond on the chat. So we have Praveen, Supriya, Dipshika, Sankalp, Tanu, Shreya, Ruby, Shiladitya, Shamli, and Hitakshi. If you can respond on chat. Shamli, you can go.
Yes, sir. Good evening. So, sir, I think here the variable would be that the anxiety levels in different individual would be different. Some might be okay with that, like with the music therapy or the virtual reality, they'll be like less stressed or the anxiety level would go down. And some people might not have that much of effect. So I think the level of anxiety would differ within the individual, how they perceive that virtual reality or the music therapy.
Okay, Shan. So thank you for correctly identifying that anxiety levels is the study variable. Okay. We go to the next example. You can read and respond. Anybody wishes to respond to this? Deepshika.
Good evening, sir.
Yeah.
Uh,
Deepshika, can you be a little louder?
yes, sir. I think in this the study variable can be the capability of the students on interpreting the nutritional values written on any packaged food, and then decide whether it is good for them or not based on the types of nutrients given in that food.
Okay. So Deepshika, your voice was a little feeble, so could not understand clearly. But I take it that you are trying to find out as to how the study investigators or authors would have measured the capacity, right? So as it appears on the objective, it's not clear as to how did they measure the capacity. So probably they might have used some tools which is meant to measure. Probably you give that questionnaire to students, probably, or that exam test to the students, and the student writes that particular test, and you can come out with marks. Let's say if there is a 20 MCQ test, And you might have cut off that if at least 10 questions are answered correctly by the student, we label the student as to be having reasonably good capacity. So then we might say that what proportion student had reasonably good capacity on reading the label. Or we might just give the median score or the average score that the students had on those 20 questions. Right? Thank you, Dipsika. We move to the next example. You can read the example and respond. Any responses? We'll need someone to answer so that we can move forward. Shamli, yes.
Yes, so here also we are interested to know about the proportion of households who can dispose their medicines. So here the number of households, that is the variable.
Yes. So in scientific terms, we say that we convert the numbers into proportions so that we can make comparisons. So if this study comes up with a proportion of 30%, some other study comes up with a proportion of 50%, we can compare and see what could be the reasons why the proportion is different, right? So the proportion of households is the variable. We can take the last example. Someone wishing to. Thank you, Dipsika. You can read this and identify. Xerophthalmia is a disease of eye, which happens because of vitamin A deficiency, mainly among children. Okay, Shreya wishes to. You can go ahead, Shreya.
Hello.
Yes, sir.
Yes, as in residential schools, there is, vitamin A deficiency. Xerophthalmia takes place from the vitamin A deficiency, and in residential school, we know that the criteria I don't think is fulfilled because the carb-centric diet and all. So I think xerophthalmia is more prevalence in residential school and hostel children living in hostels, and also we can examine the nutrient quality of food. By that, we can examine the vitamin A deficiencies. If I'm not
Okay.
wrong.
Yeah. So Shreya, I understand that. So depending on what exactly you might be interested in, your study variable would differ. The way that the current study objective is described, it says that only the prevalence of xerophthalmia is the study variable. So the prevalence, let's say, and since vitamin A deficiency is not very common now because of the supplementation, ongoing supplementation, so you might find prevalence to be somewhere around 1%, 2%, 5%, even 5% would be too high, right? So that's the range in which your expectation would be. So someone would be interested in finding out if it's very high or is it under control, right? In ideal situations, you would usually looking at the vitamin A supplementation program happening in the country. You would not really expect any xerophthalmia cases. But if you do see in some pockets, in tribal pockets, you might observe that the coverage of vitamin E supplementation is less, and hence you might expect that. Right. So prevalence of this particular condition among children is a variable. Right. Okay. So thank you everyone for participating and interacting. So that gives us an idea that you are understanding the concept of study variable. So from study variable, now we move on to the second part of the study objective, and which is study population. Now, when we look at the study population, there are some concepts which are important. So let's understand those concepts. So in study population, there are three important concepts. So that would probably help us in our study methodology as well, right? So the concepts are, what is the total or reference population, which is the population which is accessible to the researcher. So in our case, the student or the teacher or faculty and guide. And what's the study sample, right? So study sample is actual people who take part in your study. So you might say that I did the study among 30 patients or among 200 patients. So those 200 odd patients are your study sample, right? But you took them from some hospital. The hospital OPD might be 500. Out of 500, you took 200 patients, or let's say 50 patients. But then whatever condition that you studied upon, your findings might probably relate to all the people with that particular condition. So all the people with that particular condition will become the reference population on whom you are extrapolating your findings, on whom your findings might apply, right? So reference population, accessible population, and study sample. So how do we usually describe this? So we describe the total population in terms of clinical and demographic characteristics. So say, for example, we have taken one example here, that let's say the clinical characteristic is that the person is having hypertension, high blood pressure. Demography, we have mentioned that the person has to be adult. So we are not talking about children here, right? So hypertensive adult patients in India becomes my reference population. So whatever be my study, I am primarily interested in this particular patient population. So whatever be my findings would be applicable to these people probably. What's accessible to the population? Now, not all adult hypertensive patients in India would be accessible to me because I am located at a particular medical college hospital. So at the most, I can have access to, let's say, people residing in the nearby area or people who are coming to the hospital OPD, right? So that's accessible population is the sampling frame probably from where you will draw your study sample. The accessible population is defined by geographic and temporal criteria. So, say for example, here they have mentioned that hypertensive patients attending my OPD or OPD of a particular XYZ hospital, and they also mentioned the duration. So, all the people coming in the year 2026, in calendar year 2026, all of them would be potentially there, and I'll be probably choosing some of them, right? So, I might say that I'll choose, I'll go to the OPD every Monday. So we have 52 Mondays, and people will come from all during those 52 days, something of that sort, right? So accessible population is defined by geographic and temporal criteria. Study sample is actual participants. So let's say you might not be, hypertension is a very big, broad topic, and you might you usually want to be more specific about what within hypertension you wish to study. So you might say that you are interested in finding out what are the reasons for uncontrolled hypertension, or among which population uncontrolled hypertension is more common. So is it more common among elderly, or is it more common among people who have other comorbidities associated, or is it more common among a particular gender, or among a particular socioeconomic status, or something of that sort, right? So your interest is only those people who have uncontrolled hypertension, right? So that becomes your study sample. We'll take few more examples and understand these concepts around the study population. Right? So at the top, you have a shortened version of the study title, or the study aim, you can say. So this study is to study the capacity of villagers on managing snake bite. So understand, we'll start with the study sample. So what did they actually study? They actually studied 50 farmers, 50 college students, and 50 teachers from one particular village, right? So probably, what was the population from which probably they drew this particular sample? So their accessible population, which is geographic and temporally defined, is residents of a village in Kolar district in Karnataka who were available between October to November 2025 when the study team went out for the survey, right? So there would be many households who would be locked. So those households were not accessible. So they were excluded, right? So your study sampling frame is only those people who are available for interview when you went for data collection. And then let's say your study is about capacity of villagers. So when you say that, let's say whether the villagers, what proportion of villagers could correctly identify the poisonous snake. So that knowledge information probably applies to a larger population. Let's say, so that information might apply to, let's say, all the rural villagers of Karnataka, that particular district in Karnataka, right? So it applies to other population of the other villages as well, right? Beyond that, probably it has limited value. In other districts or in the other states, the proportion of people who have that correct knowledge might be a little different, right? So that's your total population or reference population on whom you wish to extrapolate your study findings. Now, these concepts would help us. So study sample, you'll have some inclusion criteria in your study, right? So the inclusion criteria would be, let's say, I'm interested in only patients with a particular severity of the disease, right? So, and the accessible population would help you in the writing methodology section of your study protocol. But the total population or reference population would be helpful when you will be writing the study implications. So yesterday when we looked at the different section of the ICMR STS protocol, the last section before reference is study implications, right? So when you write what are the implications of your study, you will once again refer back to the reference population. That whatever results that comes out of my study would be applicable to this population and somebody would be able to do some kind of intervention there, right? So that's the importance of having clarity about what's my reference population. Let's take a few more examples. So this example is about studying the delay in treatment among myocardial infarction patients. So the actual study sample is patients who received treatment at the study site and had accessible medical records. It came from patients presenting the emergency room of hospital XYZ during a particular month, right? So we are sharing information about where do the patients came, which particular hospital, or within the hospital also. Sometimes a study will be such, it will specify that you took up patients only from emergency room indoor, or you took patients from the OPD of a particular department, or you took up only patients who are admitted at ICU of a particular department, or the department is running only specialty clinics. So, for example, the hospital is running non-communicable disease clinic, the hospital is running diabetes clinic, or the hospital is running an elderly clinic, right? So if you are taking patients from there, you define it that patients coming to this OPD during this tenure, this period of time were taken, right? But the findings were probably applied to all adult patients with myocardial infarction in that particular city, maybe, right? Let's take the next example, which is, now this is interesting. This comes from dental sciences. It is readiness of parents to attend first dental visit within 3 years of a child's age. So dental problems are increasing, and hence, otherwise, we did not think that children under 3 years of age might need a dentist visit. But the kind of dental problems increasing, the parents should, the problems are such that the parents should be taking the children to dentals. A dental clinic, but then not many parents are ready. They do not have the necessary aptitude or not necessary awareness, right? So dentists are interested in finding out, are parents really be ready or not, right? So that's the study around readiness of parents. Now we understand that since the study is readiness of parent, we cannot do the study in dental clinic, because if people do not come to the dental clinic, we have to go somewhere else. So one option is we do a house to house survey, identify what proportion of houses have children under 3 years, and do the survey, which might be a little more time consuming, a bit more difficult and complex. So we can do something else. So we can identify if other places where children under 3 years of age would be coming. So we can think of vaccination clinics, and that's what the study actually did. So the study is among 208 parents who agreed to participate in the study. That's the study sample. So who are coming to the vaccination clinic. So some of the study participants might not agree to participate, and hence you will not be able to include them in your study sample. Your accessible population is parents of children who attended the vaccination clinic of a particular hospital during a particular time period, right? But your study findings would be applicable to more people as well, right? So parents of children under 3 who are responsible for making decisions regarding the child's first dental visit. So that was one more example which helped us clarify the concept of what is the actual study sample it comes from what sampling frame or accessible population, and my findings are relating to what particular reference population. So these were the second part of study objective, which was the concept of my actual study population, on whom the study was done. So the two parts of objectives we discussed. One is what exactly are we going to measure and find and document in my study, and among whom. So what do we measure and among whom are two important parts of the objective. So if whatever the number of objectives that your study might have, be 2 or 3, always make sure that each of your objectives has very clearly communicates these two components. What does your study exactly measures and among whom? Lastly, this is the last slide where we share some of the tips. We have come across a lot of undergraduate students writing research proposals, and the common mistakes are two primarily. One is having too many objectives. So we have come across proposals where the students are very ambitious and they write 5 or 6 objectives. Now that's too much. When we go the next 2 weeks, when we go into the more details, calculating the sample size, defining study variables, also planning for the data analysis, we realize that as the number of objectives increase, your complexity of writing methodology also increases. So it's always better to go forward with less number of objectives. We have seen a lot of studies in ICMR STS which are selected in ICMR STS, which goes with just one objective. If someone gives me a choice, I would usually go with just one objective, so that I'm very clear as to what I'm doing, and I have simplified expectations out of my study. So that's how the nature of research itself. The research is never done where you try to attempt and document and prove a lot many things. Usually it would be better to go with focusing only one aspect at a time in research, right? So having a reasonable number of objectives is the first advice. Second common problem is the objectives are very vague. Why you spend a lot of time explaining as to what is the study variable and what's the population, and why it is important to make it very clear the study variable and the population is many times the study objectives are not clear. So many times it's not clear, the study population is assumed and it's not documented well, right? So it's important there. So, and we understand that for many of you, since it would be your first research in your life, you'll find it difficult to articulate a very clear study objective, right? But when you do that, some of the tips would help. First is when you meet with your guide will be able to tell you and make it more specific and focused. Second advice is if you can put it on paper. Many times students have habit of verbally discussing it with their friends or with the guide. But if you put it on paper, probably if you write your study title or study objective on a Google Doc and share it with your guide, or probably write it in a Word document, get it printed and share it with your guide. So if it is in documented form, your guide will be able to give specific inputs as to how do you make it more refined, right? So put it on paper, get it reviewed by your friends, get it reviewed by your guide, right? And revise, make drafts. So the first draft would be a little more vague. It would not have, let's say, a lot of clarity, but the second draft would have better clarity. The third draft might become the perfect one, which is ready to go into your STS proposal itself, right? Another important piece of advice would be many times, since first and second MBBS is such time where you did not have sufficient clinical exposure. So many times you end up committing something in your STS proposal. When you actually go on doing data collection, you realize that collecting, accessing those patients are difficult. You realize that patients would come during morning hours, and then you are attending your routine lectures during morning hours. So it's not possible for you to go and meet those patients, right? Sometimes you might realize that language is a barrier communicating with the patient. Sometimes something else might crop up. Sometimes you might realize that not sufficient number of patients are available, although someone promised that they will be able to make access to patients, they'll be able to make it, will be able to do some laboratory tests as well. But when it actually comes to doing that during the data collection phase, you might realize that you are running into troubles, right? So it will always be a good idea to do a pilot study. So, for example, if your study is about finding out something, let's say finding out quality of life among patients with nephrotic syndrome in pediatrics, so would we go and talk to mothers of children with nephrotic syndrome in pediatrics, go to 10 mothers and apply that questionnaire, so get a printout in the vernacular language of that questionnaire, ask those questions, talk to mothers and find out what practical problems do you face. So that would give you a reasonable estimate as to what study sample you should be taking, what sample size you should be taking, or whether you have a questionnaire in the vernacular language which can be easily applied. If not, probably you'll have to create one, translate one, and validate that as well. Okay. So a lot of that would happen when you do the pilots. So since the deadline is approaching and 30th May is not very far, but if you have already selected and finalized the topic, it would always be a good idea to do a pilot study. So that's a piece of advice to make your objective little more clear and refined. So that was the second part of our session where we talked about study objectives.